What is hematology? Hematology is the science or study of blood, blood forming organs, and blood diseases. In the medical field, hematology includes the treatment of blood disorders and malignancies, including types of hemophilia, leukemia, lymphoma, and sickle cell anemia. Hematology is a branch of internal medicine that deals with the physiology, pathology, etiology, diagnosis, treatment, prognosis, and prevention of blood related disorders. Hematologists focus largely on lymphatic organs and bone marrow and may diagnose blood count irregularities or platelet irregularities. Hematologists treat organs that are fed by blood cells including lymph nodes, spleen, thymus, and lymphoid tissue. Anatomy of blood. Blood is made up of several parts including red blood cells, white blood cells, platelets, and plasma. Red blood cells, which make up about 45% of whole blood, carry oxygen from the lungs to the body's tissue. They also carry carbon dioxide back to the lungs to be exhaled. They are disc-shaped in structure and produced in the bone marrow. White blood cells, which are also made in the marrow, help fight infections. Together with platelets, they make up less than 1% of the whole blood. Platelets are small colorless fragments that stick together and interact with clotting proteins to stop or prevent bleeding. They are also produced in bone marrow. Plasma is the fluid part of the blood composed of 92% of water. It also contains vital proteins, mineral salts, sugars, fats, hormones, and vitamins. Areas of studies. 4 major areas of study within hematology include hemoglobinopathy, hematological malignancies, anemia, and coagulopathy. Hemoglobinopathy is the study of abnormality in the globin chains of hemoglobin molecules. In addition to sickle cell anemia, thalassemia is part of hemoglobinopathy. The area of hematological malignancies is concerned with the diagnosis and treatment of cancers of bone marrow, blood, and lymph nodes. Myeloma is one type of hematological malignancy, along with leukemia and lymphoma. Other disorders treated by a hematologist include arterial thromboembolism, deep vein thrombosis, and neutropenia. Hematology oncology. Although hematologists work together with experts from various medical and surgical specialties, hematology is most often linked with oncology. Hematologists and oncologists work together to care for adults and children with cancers of blood and bone marrow, including leukemia and lymphoma. Hematology tests. One of the most common hematology tests is the complete blood count or CBC. This test is often conducted during a routine exam and can detect anemia, clotting problems, blood cancers, immune system disorders, and infections. Other hematology tests include blood chemistry test, blood enzyme test, and blood tests to assess heart disease risk. What is hematology in Johns Hopkins? What is hematology? Hematology is the study of blood and blood disorders. Hematologists and hematopathologists are highly trained healthcare providers who specialize in diseases of the blood and blood components. These include blood and bone marrow cells. Hematological tests can help diagnose anemia, infection, hemophilia, blood clotting disorders, and leukemia. The difference between hematologist and a hematopathologist. A hematologist is usually a board certified internist or pediatrician who has completed additional years of training in hematology. The hematologist generally focuses on direct patient care and diagnosing and managing hematological diseases, especially the cancers. Hematopathologist is usually board certified in both anatomical and clinical pathology and has additional years of training in hematopathology. Hematopathology is not only the study of disease of the blood and bone marrow, it is also the study of the organs and tissues that use blood cells to perform their physiological functions. These include the lymph nodes, spleen, thymus, other lymphoid tissue. The hematopathologist focuses on the diagnosis of conditions of the hematopoietic and lymphocyte-rich tissues. This is usually done by direct exam of tissue and blood in the test. Common hematological tests include CBC, WBC count, RBC count, platelet count, hematocrit, red blood cell count, red blood cell volume, HCT, hemoglobin concentration, hemoglobin HB, and differential white blood cell count, red cell indices, platelet count, PT-APTT, prothrombin time, and the thromboplastin time. Bone marrow biopsy is not a common test in general, but is a common test for hematologists. It involves taking cells from the bone marrow for analysis for many types of diseases.